Well, Michigan Ear Institute has been around since 1986, and we had one fellow for 1 year at a time.
We have a great fellowship program here at the Michigan Ear Institute. Sometimes our fellows think it's all about them, and it really is.
Our fellows are well trained both academically and surgically.
And we've educated over 60 physicians who practice throughout the United States, either at universities or at private practices.
They also do very well in academic centers, both as clinicians, program directors, and chairmen of departments.
We were one of the first programs to be ACGME certified. Because of our large volume, the number of fellows has increased. Now it is a 2-year fellowship, and we have 2 fellows that have been accredited for each year. About 10 years ago, about 50% of the graduates went into academic practice and 50% into private practice. Over the last 10 years, about 80% went into academic practice and 20% into private practice. And the fellowship program really has turned into the jewel of Michigan Ear Institute.
Our fellows are treated as junior faculty members when they come in. We really trust their opinion. We look forward to their viewpoint. We trust their training of where they're coming from to really give us a better experience, maybe even for ourselves to learn a little bit about how to take care of the next patient that we're about to see together.
We offer our fellows very comprehensive training for the otology and neurotology patients. They participate in the preoperative evaluation of the patient, their surgery, all their postoperative care, including their postoperative care in the office.
That's when they get to see what does an ear look like as it's healing. We can see postoperative complications together and make sure we can diagnose them. So there's huge value for them. And I think they wish sometimes they could spend more time in the clinic just to see that type of postoperative care.
To this end, it gives the fellows the ability to see their successes and also to be able to treat their failures in order to make those failures future success.
We see patients from all over the state of Michigan, Northern Ohio, and Indiana. And by seeing that wide range of patients, we have a tremendous draw of skull-based procedures that we do. We also offer radiotherapy for many of our tumor patients that we see. In addition, we have a chronic ear practice that's really quite unique.
Our surgical volume is extremely high. We do about 2,500 chronic ear cases per year, which are spread among the fellows.
We have a reputation for excellence when it comes to skull-based surgery, chronic ear surgery, and we have the ability to work with multiple neurotologists that we can bounce things off of. We get multiple viewpoints on, and that really adds on to the experience that you have here.
One of the best aspects of the surgical experience at Michigan Ear Institute is that you get to work with so many different attendings. By doing so, you gain such a broad experience of ways to accomplish the same task. That it really equips you for really any challenge that you might come up with in the operating room.
We also are incorporating newer techniques into our practice, such as endoscopic middle ear surgery, as well as endoscopic skull-based surgery.
A typical week for a fellow here has a great variety of cases that they're seeing.
We've called this the Disneyland of otology for many, many years. So on any one day, we can be doing a chronic ear surgery followed by a skull-based tumor and end the day by repairing a superior canal dehiscence.
And meanwhile, in the other room, an acoustic tumor is being taken out through a translabyrinthine approach. That is great volume and variety.
Obviously, the skull-based, that's what the Neurotology Fellowship is about, but it's also very important learning the decision-making for chronic ears, which is not easy. And when you get out in practice, you realize it's not about taking the tumor out that's hard, but to make the decision about doing an OCR or should we take the canal wall down. And that comes obviously just with seeing a large number of patients and cases.
There are so many small details when it comes to acoustic neuroma surgery that our attendings are fantastic about teaching to you. But I think if I looked back and I thought of some of the hardest cases I had in fellowship, they were not acoustic neuroma patients. These were chronic ear patients who come in as a 3rd or 4th surgery. It's hard to imagine going into practice without having that experience under my belt. It's actually kind of scary, but I'm glad I did.
One of the reasons I chose to do ENT in the first place was my passion for treating patients with hearing loss. I loved the idea of doing stapes and cochlear implants even as a medical student, and we get an extremely high number of chronic ear patients, patients that go on to require a cochlear implant. And so that part of it has been just as fulfilling as learning the skull-based surgery.
At the end of this 2 years, I feel completely capable of handling just about anything that comes through the door.
Educating fellows is something that we take very seriously at the Michigan Ear Institute.
We've had a 100% pass rate on the neurotology board exam, and we really attribute this to our vigorous academic schedule that we have for our fellows. Our conferences include a skull-based conference, which is a multidisciplinary conference with our neurosurgery colleagues, a journal club, as well as neuroradiology conference, research conference, and audiology conferences.
I think that our most valuable didactic component is our neuroradiology conference, and it turns into a freewheeling conversation among our clinicians about not just the radiology, but also the clinical aspects of treatment based on the radiology.
The thing that I look forward to the most in our didactics is Journal Club. It's a unique chance to discuss among all the attendings and all the fellows, as well as the residents, an up-to-date article from otology and neurotology.
At our weekly didactics, the fellows are not only engaged in their own learning and academics, they actually have the opportunity to teach the local otolaryngology residents as well.
Our state-of-the-art temporal bone lab allows both attendings and fellows to partner with industry to perform new techniques and to evaluate new surgical equipment.
We expect the fellow to do research and be able to publish.
There's actually a wide variety of research that goes on at Michigan Ear Institute. Because we're such a large private practice, we have a unique resource in terms of research and clinical data. So it's very easy to generate large amounts of clinical data very, very quickly.
Most fellows come out with 3 to 4 publications during their fellowship, along with several book chapters authored with our attending physicians.
When you come here to train at the Michigan Ear Institute, you realize you're joining a family.
We start the year off getting together for a picnic lunch, and we get to meet the families, and they get to meet all the faculty at Michigan Ear along with their families.
From the moment you start as a fellow at Michigan Ear, you are welcomed into the family. Dr. Bourgeois and his wife will literally invite you into his home for every holiday. It's an extremely supportive environment. It makes it really easy to work hard.
Everyone knows everyone, and there's never any hesitation to share ideas or bounce questions off each other.
We have several meetings throughout the year just to casually get together, and that can be a boat ride, a picnic.
Our graduating fellows often call us up when they encounter any challenging cases or clinical scenarios, and it's like home.
We have office staff, many of whom have been with us from when I was a fellow decades ago. We treat them like family, and they treat us like family. And the interaction is really, it's positive, it's warm, and makes the job a pleasure.
Being an alumni of Michigan Ear Institute is a great community. We all keep in touch. We all help each other when we need to. We work on different projects even across the country. So it creates a nice big family of neurotologists across the country, and we're growing year by year.
Well, Detroit is really on the comeback trail. I'm actually a local boy, having grown up in the city of Detroit. And one thing that I have noticed is that when fellows come in, there's always been a little trepidation that we're going to Detroit, but when they leave, they absolutely love it.
Living in Midtown Detroit, we've been really impressed by how accessible the various sporting venues are, the new restaurants that are opening up seemingly every week, and the ability to get out into nature and enjoy what Michigan has to offer.
There's so much to do, indoors, outdoors. We've just really come to enjoy it here.
We have wonderful theaters, the Symphony Orchestra, the Opera House, the Detroit Institute of Art, Henry Ford Museum. You can explore each weekend another part of Metro Detroit.
It is fantastic for families. We have some of the best school systems in the country right in our area where our offices are located. It is extremely safe, and there is a heck of a lot to do.
Even friends who have visited me from Chicago, they're surprised by kind of what they get, and I think for many people it feels like a well-kept secret.
I grew up in Berlin, so I like the grittiness of the city, that there is a lot of creative energy, so a lot of artists are coming into the city, so it's fascinating to see.
It is becoming just a fantastic place to live.
Finding a program, and there aren't many of them, who's going to allow you to do a breadth of chronic ear surgery, participate in all phases of care, and still have you get some of the top acoustic neuroma and skull-based numbers in the country. I think that's going to be the challenge for most residents, finding that diamond in the rough.
So if you're looking for a fellowship where you could see a great variety of cases, huge surgical volume, great clinical pathology, and work with a variety of neurotologists with great experience and a family-friendly atmosphere, this would be a great place for you.
At the cusp of starting my own academic career, I feel as though I really almost have seen everything that I could hope to see in a training program to prepare me for what's next.
Michigan Ear Institute means a lot to me. It's been my life. We started with 3 physicians and probably about a dozen people in total in our office complex, and we've grown to close to 100 now. Education for our fellows is key, and it's always been the pearl of our practice, and we want it to continue like that.
The fellowship is really the jewel of Michigan Ear Institute. Our fellows are like our children. We are so proud of them and what they've accomplished, and really the goal of our fellowship is to train you, our fellows, the best we can possibly be, so when you get out there, you not only represent yourselves well, but represent Michigan Ear.